there, this is Sujata Martin from Concierge Pelvic Floor. I'm your pelvic floor occupational therapist and certified birth doula. And today we are going to talk about perineal tears or birth tears and how to safely take a pee and keep your stitches intact, and B, when you take that first poop or bowel movement, how to protect your perineum, and of course how to protect your perineum at every subsequent poop till healing happens better. So I have a very handy little illustration I'm going to share with you. Now I am not Da Vinci, so this is not fantastic anatomically, but this is a good representation of what your private parts look like, right? So this is your vulvar area, which is the outer part of your genitals. This here is your vagina, your urinary opening, and that little circle on top is the clitoris. Now this is your anus or anal opening, and this space right here between the two is what we call perineum. Now when women have a vaginal birth, they often tear. Now that is not to scare you, but rather it is to tell you that just like sometimes runners who run a marathon get like a sprain or a overstretching injury, and they are fine because their body heals, they know what to do. Similarly, with women who birth vaginally, tearing is a common part. It is completely normal. It is avoidable. Now that is a topic for a different discussion. But do not be terribly afraid of tearing. Your vagina is this fantastic organ that is so vascular. It has such a fantastic blood supply. It heals up really, really well. And doing little things that I'm going to show you today is just going to help that process along. Okay, so when most people tear, they tear straight downwards towards the anal opening. Now some people tear upwards. It is definitely rarer towards the urethra, and sometimes you can have a tear sideways. Rare, but the most common is downwards. Again, if your provider gives you an episiotomy, which is where they cut your perineum to help baby come out, now that is not an evidence-based practice for all pregnancies and all deliveries. However, at some situations it is definitely necessary. So right now most providers cut that episiotomy straight downwards. Other technique used to be doing sideways. Now this is something you have to talk to your provider which incision they typically use, but they may have it straight downwards or to the side. In any case, you probably are going to have stitches if you have a grade 2 tear or higher. I'll do another video talking about the various degrees of tearing. We won't talk about that now. So anyhow, if you have a grade 1 tear, there may not be any stitches, but you still want this to heal well. If you have a grade 2 or a higher tear, then you definitely have stitches and you want to take some extra care. So every time you go to the bathroom, if you pee, please do yourself a favor and instead of initially dabbing with toilet paper, use water, use a bidet, use one of those squeeze bottles the hospitals give you, whatever works for you. Use water to clean yourself and then gently pat dry if needed. You can even use a soft cloth that you always keep in the bathroom, that is just for this purpose, so you don't have to use toilet paper and it gets sticky, and especially if you have stitches over there, it can be irritating for some people, especially if you have sensitive skin. So do what works for you. Second thing, when you are trying to have a bowel movement, first of all, if you have lost blood, you are dehydrated, if you're on painkillers, just in general after pregnancy, because your core has changed so much and now baby's on the outside, a lot of women have difficulty going to the bathroom for the first time. Again, do not be scared, do not hold it in because you're so afraid of how much it's gonna hurt when it comes out. A good idea is to take a magnesium supplement. Natural Calm is one. You can ask your provider for a magnesium supplement. It just helps soften the stool, so you don't have to push down as hard. Also drink a lot of water. Again, water is going to help you be hydrated, and also if you plan to breastfeed, it's going to help with your breast milk. Also going to help replace the blood volume you've lost. So great. So just keep yourself hydrated. That's going to help. Right. The third thing you can do, which we're going to talk about today, is called perineal splinting. Now, what does splinting mean? I'm going to show you with my handy toilet paper. You grab your toilet paper, you take a nice generous roll, okay, and you fold it up nice and neat. And what you're going to do is, after you pee and you put your water, you're going to put gentle pressure against that perineum to dab after you pee. And if you have to poop or have a bowel movement, again what you do is put your hands between your legs, and in this area just give that gentle pressure against your stitches, up inwards, and then poop. The other thing you can do to help keep your stitches intact is, when you poop, when you're trying to push, first of all, don't like bear down hard. Put that counter pressure and breathe out as you push. That's going to help. Now, if you had a C-section, you do the same thing. You do the splinting, but instead of your perineum, where moms who had a vaginal birth give pressure, if you had a cesarean birth, you are going to give pressure on your incision. Now, you can use your hands. Ideally, you want to use like a small pillow, a soft toy. Honestly, you can just use your hands even. So make sure you have your pad, your dressing intact. Put some gentle counter pressure, nice and even. And again, to push, don't push hard like that. You're going to put pressure on your incision. Exhale as you push down. Okay, that's going to help. Something else that's going to help is using a squatty potty, or even for moms who had vaginal births. Squatty potty is not going to hurt your perineum. It's actually going to protect it by having you push lesser. So what the squatty potty does, and you can use whatever brand potty you want, potty stool you want, I'm sorry. You want your knees higher than your hips. So what the squatty potty does, and why it's so great, is that and I'm on my ball just to pretend, but the squatty potty puts you in this position where your knees are higher than your hips. This kind of relaxes the pelvic floor. It does, not kind of, it does relax your pelvic floor, so there's less pressure on it as you're having that first bowel movement. So that nice position with your knees higher than your hips, and that perineal splinting or that core splinting, if you had a C-section birth, is going to help you have that bowel movement with less pressure, and it should help your stitches heal better. If you have any other questions about healing after birth, feel free to reach me at pelvicflowbuffalo.com, or you can comment on this video and I'll get back to you as soon as I can. Feel good, feel better, and happy healing. Bye.